Hello, my name is Jasmine. I am an occupational therapist for the University Hospitals of Derby and Burton Foundation Trust. I work within a team of occupational therapists at Group Rehabilitation, supporting patients to safely and sustainably return to work. Like all healthcare professionals, we have needed to adapt the way we work to meet the demands of the COVID-19 pandemic. We are seeing a growing number of referrals for patients who have ongoing symptoms. Some patients are recovering from extensive medical intervention and hospital admission. Others experienced a relatively mild acute phase, but remain debilitated by symptoms of extreme exhaustion. Having supported patients in returning to work since May 2020, we now understand many of the challenges that employees and managers face as they navigate through the return to work process. It is quite normal to experience symptoms for a short time beyond your isolation period as your body recovers. This is the first of a 4-part video series which offers return to work advice for those who are experiencing lasting symptoms of COVID-19, regardless of the medical interventions that they required. In this video, we will look at how you, as an employee, can manage your symptoms during sickness absence, with the aim of feeling well enough to sustain a routine made up of light activity. We will explore how you can maximise your energy levels and gain some consistency from day to day. And finally, we will look at sources of support locally and also within your workplace. People experience a wide range of symptoms during the acute phase of the virus, and sometimes for a number of months to follow. These include fatigue, coughing, breathlessness, anxiety, low mood, difficulties with sleep, and pain. All of these symptoms, especially if combined, can make it very difficult for you to engage in day-to-day activities as you normally would. It is normal to feel like you are the only one struggling with symptoms, especially if you experienced a relatively mild acute phase of the virus. However, acknowledging that these symptoms are real and are affecting your ability to function as normal will help you to begin to manage things better. This video will look more broadly at general symptom management principles. Remember that if symptoms are unmanageable and not improving, to speak to your healthcare professional. Your GP can only offer support if they know that there's a problem. Having bad and better days is normal, especially in the early stages. These symptoms are very challenging to manage, especially if you are normally very busy, simultaneously juggling work and home life. It has been described in a British Medical Journal blog as being followed by phantom speed cameras. You don't know the speed limit and you don't know when the penalties will arrive. However, before you return to work, you do need to find some consistency. This way you have a better understanding of your limits, your ability to function will be more predictable, and you and your manager can plan a return to work which is manageable. Let's explore the boom-bust cycle. If you push yourself to your limit, or until the symptoms stop you from continuing, likelihood is that you will experience an extended recovery, a period where your symptoms worsen and you are able to do less. As you rest, you might then begin to feel better and more able and decide to push yourself to your limit again, especially if you're feeling well. Again, as before, you're likely to need an extended recovery. Eventually, this can lead to a significant setback and can take several days or even weeks to get back to where you were. Not only is this frustrating, but it might also feel like your symptoms are completely out of your control. If this pattern is familiar to you, there are some techniques that you can try. One way to gain some consistency in your activity levels is to plan your week. Set out what you aim to achieve in one day and only plan what you know is manageable and does not require a recovery lasting longer than around 10 to 15 minutes. This might be a much lower level of activity than you are capable of, but overall your symptoms may be less severe, your level of activity through the week is likely to be more consistent, and you will hopefully have a greater sense of well-being. Try to include things that you enjoy, for example spending time with your children or taking a short walk outdoors. Try to also include something restorative which allows you to relax. This might be listening to music, breathing meditations, or having a warm bath. Include tasks which allow you to remain productive. This might include light cleaning, helping children with little homework, or even unloading the dishwasher. Whilst these tasks might have previously seemed effortless, each thing will be using up energy reserves. The next thing, it is important to pace yourself. It is very tempting to test yourself with bigger, more energy-consuming tasks, especially on days where you feel well and more like yourself. However, prolonged periods of physical activity are likely to lead to symptoms such as breathlessness and fatigue. At the same time, prolonged periods of very sedentary behaviour can lead to deconditioning, low mood, and can affect your concentration. It is therefore important to strike a balance between the two. Rather than approaching large tasks in one go, as we perhaps would normally, try to break it into smaller chunks. For example, if you would normally spend all day working on the garden, try splitting it into more manageable chunks which will be completed gradually over a week or month. Planning to spread tasks throughout the day, rather than squeezing it all into the morning, may help you to feel better in the evenings, and it might also be more similar to your working day. Prioritising the way you spend your energy is very important, and it would be worth thinking about how you can make things easier for yourself. Prioritise the things that bring you joy and facilitate your recovery. There may be certain tasks, such as loading and unloading the dishwasher, that you find particularly challenging, and which means you do not have enough energy to do other more important things. Whereas for a friend or a family member, it is likely to be a 5-minute job which has no bearing on the rest of their day. Small adjustments like these are likely to make a big difference. Try to regularly remind yourself of why you have made these changes. Your main aim during sickness absence is to feel well again and to gain some control over your symptoms. If, after a couple of days, you begin to feel better in yourself, try to resist the urge to increase your level of activity too quickly. Instead, appreciate an improved feeling of wellness and aim to maintain this as you move forward. Continuing to plan your week, you can then gradually increase your activity levels, always using the rate of your recovery as a guide. There are a number of resources to help you manage your symptoms. The Your COVID Recovery website by the NHS is available online and offers some very useful insights into why you might be feeling the way you do. And if you haven't already, you can speak to a healthcare professional for individual advice. CIC is an employee assistance programme which offers a counselling service to UHDB staff. You can email, call or start a live chat online. At a time where people often feel more isolated than ever, they can help you to work through any anxious thoughts and low moods. They can offer up new ways to cope, and it is a confidential place to talk through any feelings of hopelessness or fear. If you are not a UHDB staff member, but live in the Derby or Nottingham area, Trent PTS also accepts self-referrals for psychological therapies. Services such as these are operating nationally, so if this is something that interests you but you're elsewhere in the country, speak to your manager to see if there is an employee assistance programme provided by your employer, or search online for a self-referral service like Trent PTS. And finally, during sickness absence, I would like to remind you to always protect your role and avoid making rash decisions about work. Ensure that your absence is covered with either a fit note from your doctor or an AHP fitness for work report from your treating therapist. This will ensure that you are eligible for contractual pay. You will need a fit note from your doctor if you need to claim employment benefits. If you have access to occupational health through your employer, ask for a referral from your manager. They can help you to decide when you are ready to return and offer you and your manager guidance during the return to work process. If you have a HR department, they can support you with any queries regarding pay or company policies. They may have additional support for absences which relate to COVID-19. We hope that you found this information useful, and please see videos 2, 3 and 4 for more guidance on the return to work process. Thank you.